Hi, I'm David Hammond, International Livings Correspondent in Uruguay. I'm talking to you from Montevideo, Uruguay's capital city. The first case of COVID-19 was reported in Uruguay on March 13th. In this video, I'm going to answer some questions what it's like today in Uruguay with COVID-19. What's daily life like at the moment in Uruguay? Well, in Uruguay, most retail businesses, except for stores that sell food and pharmacies, are closed. People leave home less often, and some people who are at higher risk stay at home all the time and have their groceries and supplies delivered to their door. Uruguayans are a warm people. A kiss on the cheek and a hug is a common greeting, and they tend to stand close together when interacting, so the social distancing is a big change. Next question, how are you passing the time? I spend most of my time reading, writing, and checking in with friends. A few days a week I try to get out and take a run. I usually go on the Rambla, which is a wide walkway that runs the full length of Montevideo along the waterfront. It's plenty wide enough so I can observe social distancing space along the way. I've also started taking some online courses in the evening to replace my social time. And as you may have already noticed, I've also taken to cutting my own hair. Can you go to the shops? Is your country in lockdown? So far, no forced lockdown or quarantine in Uruguay. All food stores are open. Stores that don't have automatic sliding glass doors keep their doors open all the time so you don't have to touch a door handle to get in. Most stores have tape on the floor to show you how far to stand apart while you wait to check out. Also in my local market, there's a glass shield between the checker and the customers. And in small stores like bakeries or health food stores, they limit the number of customers that are allowed in the store at any given time. All the stores I visited have been fully stocked. I don't see any shortages. Is public transportation still running? Most people in Montevideo rely on public transportation to get around. Without it, they have no way to get to work or go to a doctor. Most buses in Montevideo are still running. Taxis are also operating. In taxis, you have a clear plastic sheet between the front seat and the back seat. And with COVID-19, passengers are required to ride in the back seat away from the driver. Is Uruguay prepared for the virus? So far, I'm impressed with the way Uruguay has responded to the virus. Let me give you some examples. A group of businesses got together and formed an organization. They all threw money in the hat and raised over $2 million to fight COVID-19 in Uruguay. With that money, they purchased 30,000 COVID-19 test kits. These kits work similar to a diabetics test. You prick your finger and they give you a result that's 97% accurate in a matter of seconds. The same group of businesses also hired 40 out-of-work seamstresses to make the garments worn by healthcare professionals when they care for COVID-19 patients. For healthcare, most people in Uruguay have a membership plan with a private hospital. They go to their hospital or one of its associated clinics for all their medical needs, everything from routine checkups to major surgery. I have my plan with the British hospital in Montevideo. Since before COVID-19 came to Uruguay, they started sending out bulletins about it. I think I've received about 9 bulletins over the last month. The bulletins explained the best practices to avoid getting COVID-19. They've explained what the symptoms are and what to do if you get it. In response to the virus, my hospital started a telemedicine program. I can download an app, and with the app I can make an appointment to have a video chat doctor's appointment on my phone or on my computer. If it appears I have symptoms, the hospital will send a specially trained doctor to my home to further evaluate and decide the best course of action from there. Nurses from my hospital and other private hospitals are visiting necessary businesses such as food production, food distribution, and food retail businesses, helping them to learn best practices for cleaning and the best way to work together to prevent spreading the virus. In addition to private hospitals, Uruguay has a large public health care system spread across the country. The businesses that gathered money and purchased the 30,000 COVID-19 test kits distributed 1,000 test kits to each public hospital and public health care center so they could act as drive-up or walk-up testing centers similar to what they had in South Korea. The government closed all schools, universities, and non-essential businesses. While they have not made a quarantine of the public a legal mandate, they frequently make recommendations of best practices for people to follow. The government has fixed prices on masks and on alcohol and gel and publishes a map of where they can be purchased at any time. Citizens are also getting involved. While employees get unemployment and people on public assistance continue to receive public assistance, many self-employed people and others fall through the cracks. That's why in my neighborhood, a group of people got together and every day they cook giant pots of soups and noodle dishes that are free to anyone. You can come and bring a bowl or bring a big container to take back to your family. Here's another question. How are you preparing for the future? Well, I'm keeping my normal routine as much as possible. I'm trying to keep a regular schedule, which includes daily exercise. I'm taking some online classes so that I'm improving myself a little bit during this time, and I also take a little time each day to study Spanish. How do I keep in contact with people? I mostly keep in contact with people by email. I have a local friend that I'll call. We check in every day by telephone and make sure we're both doing okay. And I talk to my daughter and grandson in the U.S. by video chat.